Welcome to Part 4 of Skyscape's Orientation Series, Implementation of Skyscape in Clinical. Our presenters today are Dr. Tim Bristol and Karen Sherrill. I will now hand the floor over to Karen.
Thank you, Kristen. I welcome you today, and I hope that you've had a chance to view the other videos that we have within this series. If you have not yet looked at the Quick Start Guide, the Faculty Orientation of Skyscape, I'd encourage you to go back and watch that one first. It will help you with some of the foundational navigation, and you'll have a better understanding of how to apply the concepts that we're going to be talking about within this webinar. Dr. Bristol and I have been using Skyscape for many years with students, and we have found it's especially beneficial as a clinical tool for our students. I think it's important for us to be taking a lot of pieces that we're using within the classroom, migrate those into the clinical, and it's very important that students are able to see that transition. So as we create those habits for our students using the Skyscape resources within the classroom, it's really important that we're also supporting that within the clinical setting. One thing I'd like to preface this by saying is that in my mind, clinical simulation is clinical. So not only within this are we going to be discussing ways in which to use Skyscape in the actual agency, but also consider clinical as simulation being the same. You know, students need to be using these resources as they're working in the simulation lab, just as they would be using those resources as they're working with patients in the agencies. The beauty of a tool such as what Skyscape offers is it really is the ultimate active learning environment. And when you look at the clinical setting, that is a built-in active learning environment. It really creates that pretense to our students and gives them access to such a variety of things that they're going to be exposed to. It's really important for us to be taking advantage of some of those materials that are already out there and incorporating the materials that students have available to them, such as their Skyscape products, and blending those two in order to make the very best, safest learning opportunities for our students. I'm going to talk through a variety of resources and activities that you can be utilizing, and then I'll turn the presentation over to Dr. Bristol, who will do a hands-on application of a situation that you can be using in your clinical setting. So first I'd like to talk to you about one activity, and that is really accessing and utilizing the electronic health record, the medical record that students have available to them. I know many facilities are somewhat hesitant to allow students to gain access to these, but it is important that we're persistent with this. I think back to just a few years ago and where we were at with this process, and students were completely shut down and unable to use any of the resources within the agency. But I'm finding, at least the area where I'm at, and as I talk throughout the country, I hear the same from other schools of nursing, is that agencies are really becoming more accommodating to allow students to have access to these resources. So it's important to use those as a learning tool for our students. So an activity would be having your student doing some research within that electronic health record. And you might have them look at a particular medication, for instance, that they've been talking about in class. So maybe you're going to have them explore an electronic health record of a patient maybe that is on Epogen or is on an anticoagulant therapy or an antibiotic therapy. Whatever it is that pertains to their curriculum that they're using in the classroom, transfer that over to clinical and have students find a patient that's taking these particular drug categories of medications, and then utilizing their Skyscape tools, they're going to be exploring that electronic health record and watching for trends of information within that patient record. Can they help to determine why it is that patient would be on the medication? Maybe they can help to detect the effectiveness of that medication. Can they find the antihypertensive the day that it was ordered, and then go back and look at the vital signs and the trends in vital signs that led up until this point? Can they be the investigator and finding their way around the electronic health record to come up with reasons in which these medications were ordered? If the patient was placed on maybe a diuretic, can they find that there was a response to that? Are they able to explore and look at the patient's weight or look at the eyes and nose and see that there's improvement in their lung sounds as a result of that medication? And of course, utilizing those Skyscape resources is going to provide them with the details that they need in order to really evaluate and critique the material that they're seeing within the patient's electronic health records. You might have them look for some anticipated effects as well as some unanticipated effects. Can they help to detect maybe some abnormalities? Maybe there were some lab changes. Maybe the patient experienced some neurological changes as a result of those medications. Can they detect that through the documentation process? And this is going to build many skills for your students. They're going to use those critical thinking skills. They're going to learn navigation through that electronic health record. And they're also going to learn a lot from exploring and seeing how nurses document and recognizing the value in good documentation versus poor documentation. Another process or way in which you can utilize these resources is think about your post-clinical conference. I know that the tradition for post-clinical conference is, in fact, to walk around the table and to talk about experiences you had for the day, which is great for sharing and it's great for debriefing, but it's not necessarily a great learning opportunity for students. So what we can have is a student who has been pre-selected for the day, and their responsibility is to bring a case scenario of an actual patient on the floor, one that they care for, bring that into the post-conference setting, and then have either as a group or within pairs or in smaller groups, have students work through maybe a concept map based upon that case scenario. Can they utilize the resources and tap into the resources that they have within their handheld device to come up with solutions and some answers as to why the things are happening with that patient that is happening? Putting the onus of learning really on the students rather than having us mandate what it is the students need to be talking about that day. Have them lead the discussions and the conversations and open up a whole new arena of ideas and suggestions. IV medications, oral medications, another great way in which to utilize the resources within the handheld devices. Having students taking a look at the medications they're supposed to be delivering that day, having them look them up as they would traditionally do. What are the nursing implications? Is this a safe dose range? How am I going to deliver this medication? Why is my patient receiving it? How am I going to deliver it? Is it compatible if it's an IV medication? Is it incompatible? Using the resources within their Skyscape materials to come to these conclusions. But what I like to do to take it a next step further is not only have the student have this rote memorization and regurgitation of these critical concepts in order to deliver the med, but I like to throw them what I call a curveball, where I will have a index card where it has an abnormality, and I simply walk up to the student and hand it to them. And the curveballs could be anything as simple as you walked into the patient room and your IV is infiltrated, to you start to deliver the medication and you see that there's some cloudiness in the tubing. Maybe you're going in to give a particular medication and the tablet falls onto the floor. Maybe I need to find a different route of administration and utilizing my resources that way. There's just a whole variety of different curveballs you can throw to your student and have them walk through the process of trying to troubleshoot that. What are some resources they can use to come to the correct conclusions, the safest choices for their patient, and really stimulate that critical thinking in the clinical setting by using those curveballs. I'm going to turn the presentation over now to Dr. Bristol, who's going to show you some actual applications as he walks through the product.
Thank you, Karen. I really like the curveball idea because so many times when I'm in clinical, I feel like students get stuck in a rut, and faculty too, we get stuck in a rut of just managing what's in front of us. And we know that a big issue, a big concern on Nclex, a big concern in real life is, can you adapt the care plan? And you're using your Skyscape tools to help manage quickly. And we do have to use the word quickly. A lot of times when we're teaching clinical, classroom simulation clinical, a lot of times we try to keep it slow and paced and methodical. And unfortunately, that doesn't translate into real life very well. So anyways, love the curveball idea. Thank you, Karen. So some of the strategies that I use in clinical as well as the classroom at the same time, in the same way, as a way of helping to emphasize in class especially the relevance of what we're learning, helping to make what we're learning real. And so, for instance, a ticket to class can also be a ticket to clinical. I know in many clinical environments we are not prepping anymore, not doing that prep, and the good and the bad of it. So what we would do is we will actually email the students the night before an exemplar, a disease process, a concept, and we'll say, you need to think about this disease process. I know that you're going to run into this on the floor tomorrow, or maybe not, but you still need to be prepared, if you will. I need you to prioritize with your clinical decision support tools, with your Skyscape, what are going to be the 3 areas that you're going to look up? And so, for instance, maybe we said that rheumatoid arthritis was going to be one of those areas that you need to be prepared to help with, help provide care for, manage, if you will. So they could go into their clinical companion here, choose arthritis, rheumatoid, and they can bookmark it, okay? And you'll notice right here where I click the little caret in the lower left-hand corner, I go to the green book, and I can update this bookmark. Maybe I'll just say clinical, just so I know that it's one of the bookmarks, one of the areas that I need to understand, know, be prepared for, to utilize when it comes to clinical. Now, the student can actually go in and they can open up their bookmarks for the instructor when they get to pre-conference and go, look, I did have arthritis, rheumatoid for clinical, or rheumatoid arthritis for clinical. Here's one of my bookmarks. And I'll say, you know, you need to have 3 bookmarks ready to go when it comes to coming to clinical. That's your prep, if you will, for clinical. So it's real. A lot of times we have to help students, again, access the evidence base on the fly. So so the student, maybe the student is performing their morning assessment. They notice that the patient has an irregular pulse. It's not a regular rhythm, if you will. It's irregular, and so we look at the lab values. Sure enough, there's a potassium that's not coming up well. I'll say, okay, grab your lab manual here. Let's take a look at potassium. And I want you to talk to me a little bit. I'm going to give you a few minutes here. I want you to talk to me a little bit about why you think, what the connection is between the potassium level being this at this point and you palpating an irregular pulse. You go ahead and put those connections together using your clinical Davis's clinical companion here for laboratory and diagnostics. Go ahead and go through that, and then I'm going to come back in a few minutes and talk to you about that. Now, remember I said that I want to use strategies in clinical that I'm also using in class. So have your class hat on at the same time. Be thinking about this. For those of you doing simulations, be thinking about this. How can we make this the same activity in all those environments? As opposed to just telling the student, oh, you palpated a pulse that's irregular, and look, the potassium's low, so this could affect that cardiac conductive tissue, if you will, in the heart that helps manage rhythm, okay? And you could explain it to them, but it's much better if they look it up, because if you explain it to them, even they're standing right outside the patient's room, they're at a knowledge and comprehension level as they're absorbing that information. Whereas you make them go dig quickly, I might add, in their clinical decision support tool, that's a big deal. So another area, so many times our students are getting, you know, especially in the bigger cities, they're not doing the clinical calculations anymore at the bedside. Everything's coming up predetermined by pharmacy. The pump, the smart pumps are all set, etc. Our students need to double check and triple check and be comfortable with, you're caring for this patient on a dopamine drip. How do you know that the pump is set correctly? Well, open up your Skyscape, go into the clinical calculator here, and I want you to look for that rate. Let's see here, where is my infusion rate? There we go. Okay, so how much does your patient weigh? Go ahead and type that in. The dopamine is, how much is in the bag there? Okay, there's your 250 milligrams. All right. And how big is the bag? What's the volume in the bag? Well, that's 400 milliliters. And then the order is for 3 micrograms per kilogram per minute. So let's go ahead and enter that. There you go. Is the pump set at 19 cc's per hour? If it's not, we need to be asking questions, okay? And again, nurse, you are responsible. This is a safety issue. You're the last line of defense for this patient. So showing the students and making it a habit that the students never accept what's on the pump, what's on the bag. They do the calculations themselves. They double check. I want this to be a habit. I really do. I want this to be a habit. I want my student, if they look at a bag and a pump and walk away, I want them to feel guilty because they didn't double check that calculation. And the Skyscape calculators are just going to help them out in so many ways. Have you ever had a student in clinical say a word kind of incorrectly or funny and people around kind of laugh and snicker, right? You know, it happens. This is part of learning. Go ahead and open up your Skyscape. Go to that dictionary. Here's an example of a word. Erythroblastosis, right? You've all been there. Now look, when you open this up, a lot of these words have the little speaker next to them. See that little speaker right there in the middle, top middle? They can now listen. Their dictionary isn't just paper. Their dictionary actually is helping them learn how to say this word, okay? Now, the other part here that's a really neat feature in these dictionaries in Skyscape and a lot of other tools in Skyscape, there's a video that describes erythroblastosis. What does it have to do in this particular environment? Now I can watch a video on my phone. I'm in the break room, and I turn it on. Oh, my gosh, this is erythroblastosis. Now I get it. Now I understand. So it's way more than just looking up a word on a page. And a lot of times when you find those paper dictionaries, check out the copyright on them, right? We're talking the 80s. We're talking the 90s, right? So the student not only has a med dictionary on their phone that's automatically updated, they're actually getting media with that dictionary that helps them right there in the middle of clinical. And I think that's important. Okay, students, now here's your last challenge for the day. You've been caring for this patient for 3, 4, 5 hours. I now want you to create an S-bar that you're gonna deliver to us during post-conference. Okay, so go ahead and create your S-bars on your patient. Make sure you're using Skyscape. Now they get to post-conference and they give report on their S-bar, and you're like, good job. Now I'd like you to open up the history and show us what you used to create your S-bar. So they click on the caret there in the bottom left-hand corner. You'll see the history is that blue stack of paper there. And oh, wow, good job. Good job. You used a number of tools to develop this S-bar. That's what we want to see. We want to see you accessing your evidence-based practice tools on the fly while you're in the middle of clinical. So these are just a few ideas. Again, my goal in clinical and class and simulation is to form habits. Forming habits means that we're going to be using a lot of these tools multiple times throughout the day. And if your clinical agency isn't allowing the students to use them on the floor, then talk with the nurse manager, maybe park 1 or 2 devices in the nurse's break room, in somebody's locker. It doesn't matter. The students have got to be using these tools. This has to be a habit. All right, I'm going to turn it back over to Kristen here. She's going to wrap it up for us. Go right ahead there, Kristen.
So Skyscape has a galaxy of information. Our tool that we've just been talking about is the Skyscape Medical Library. Some other things that we have available to you as resources, we have the Nursing Skills Hub. That's coming soon. That's a mobile app where you can learn, track, and assess nursing skills. It has a over 100 skills that you can learn step-by-step instruction, video, tutorials, and then it also has related Nclex type questions. We also have available right now the Nclex question of the week. We have over 1,000 students answering these questions every week. It is available online at skyscape.com/NClexQOW, or if you like us on Facebook, you'll see it on our Facebook page, or follow us on Twitter. We tweet that out as well. Additionally, we have our our NTRAC clinical log system, which you can rid yourself of that paper burden with paperless clinical log and skills tracking system. We have a lot of tools coming down the pike for Skyscape. We're thankful that you're here listening to this and wanting to learn more about it. To learn everything you can about what we have to offer you, go to skyscape.com/groups. I want to thank you for your time. I know your time is valuable. Have a wonderful afternoon. Thank you.